With healthcare now. Louise Radnofsky, also from Washington, is joining us from the Washington Bureau, looking at a unique situation for the Tricare health plan, which is the plan used by military veterans. It seems like their children are not benefiting from one of the features of the Affordable Health Care Act, which was to allow families to let their children up to the age of 25 stay on their plans. Tell us a bit about that, Louise.
Well, you've hit on one of the most popular provisions of the health law, this young adult dependent coverage. It's very popular. Up to 6.6 million people are expected to have, or estimated to have taken advantage of it. But Tricare, the military health plan, wasn't included in the original health law. When members of Congress decided to pass a separate bill creating a provision to extend young adult dependent coverage to that program, they decided that it had to pay for itself. So they tacked on a fee equivalent to the full cost of this additional coverage. That's very different from the situation that kids in civilian families and their parents are facing. They generally don't pay an extra fee for the coverage. And the price tag isn't cheap. It's around $200 a month at the moment for some plans. It's going to go down slightly next year, but it's certainly a lot. It's a lot for 20-somethings. It's a lot for their families, and it's deterred a lot of them from seeking this particular use of this provision.
Now, I mean, it just seems remarkable that this would not be a politically popular thing to include this particular plan into the plan for the rest of the country, given how much we've read and seen of how much veterans are suffering at the moment. Is there indeed a push to have it reformed?
Well, it certainly irked military families, but the members of Congress who passed the legislation the way they did say they did it this way because that was the only way they could get political support for it. There are concerns about the cost of Tricare. There are looming defense cuts. There are a number of Department of Defense officials who are saying that this had to pay for itself, that Tricare couldn't take on additional expenses. And there's a key difference between Tricare and the forms of insurance that most civilian families are using that's really important. There aren't premiums in Tricare for most beneficiaries. That means that there isn't a bunch of people whose premiums can subsidize the additional cost of taking on the young adults. So it also tells us something about how the civilian employee plans have worked in this respect.
All right, Louise, that's all we have time. Thanks very much.